You are listening to KSG Podcast. This is a short, crisp, concise, exam-oriented, edited editorial for civil services aspirants. In this podcast, we are going to talk about global health emergency. Source for the content is Deccan Herald. A public health emergency of international concern, that is PHEIC, is the rarely used top alert available to the World Health Organization to tackle a global disease outbreak. The WHO on the 23rd of July 2022 declared the surge in monkeypox to be a PHEIC after experts reviewed the situation at an emergency committee meeting. The conditions which must be met are set out under the 2005 International Health Regulations, that is IHR, the legal framework defining countries' rights and obligations in handling public health events that could cross borders. A PHEIC is defined in the regulations as an extraordinary event which is determined to constitute a public health risk to other states through the international spread of a disease and to potentially require a coordinated international response. The definition implies that the situation is serious, sudden, unusual, or unexpected, carries implications for public health beyond an affected country's border, and may require immediate international action. The WHO's 16-member emergency committee on monkeypox is chaired by Jean-Marie Okwobel from the Democratic Republic of Congo, who is a former director of the WHO's Vaccines and Immunization Department. The committee brings together virologists, vaccinologists, epidemiologists, and experts in the fight against major diseases. It is co-chaired by Nicola Law, an associate professor of epidemiology and public health medicine from Bern University. The other 14 members are from institutions in Brazil, Britain, Japan, Morocco, Nigeria, Russia, Senegal, Switzerland, Thailand, and the United States. 8 advisors from Canada, the DRC, South Africa, Sweden, Switzerland, and the United States also take part in the meetings. The emergency committee provided WHO Chief Tedros Adhanom Ghebreyesus with an assessment of the risk to human health, the risk of international spread, and the risk of interference with international traffic, but it was unable to reach a consensus on whether or not to trigger the highest alert, Tedros said. So the WHO chief then had to decide himself. Now, the WHO has previously declared a PHEIC 6 times. 2009 H1N1 swine flu. The pandemic was first detected in Mexico and then quickly spread across the United States and the rest of the world. May 2014 polio virus. It was declared following a rise in cases of wild polio and circulating vaccine-derived polio virus. Besides COVID, it is the only PHEIC still in place. August 2014, Ebola outbreak in Western Africa which spread to Europe and the United States. February 2016, the Zika virus. The epidemic began in Brazil and heavily affected the Americas. The only PHEIC declared over a mosquito-borne virus. Now, June 2019 was again Ebola. The second Ebola PHEIC was over the outbreak in Kivu in eastern DRC. And January 2020, COVID-19. It was declared when, outside of China where the virus first emerged, there were fewer than 100 cases and no deaths. The COVID-19 PHEIC declaration came after a third meeting of the Emergency Committee on the Spreading Virus. Meetings on the 22nd and the 23rd of January 2020 decided that the outbreak did not constitute a PHEIC. Despite the declaration, it was only after 11th of March that Tedros described the rapidly worsening situation as a pandemic, leading many countries to wake up to the danger. The sluggish global response still rankles at the WHO's headquarters and raises questions about whether the PHEIC system under IHR was fit for purpose. Now, by 11th of March, the number of cases outside China had soared, with more than 1,800 people having caught the disease in 114 countries and 4,291 people having lost their lives following a jump in deaths in Italy and Iran. WHO Emergencies Director Michael Ryan said on the second anniversary of the pandemic declaration that the warning in January was way more important than the announcement in March. People were listening, we were ringing the bell, and people weren't acting. That's it for this podcast. Thank you so much for listening. To join KSG India courses and to crack the IELTS exam, visit ksgindia.com. You can also get a PDF of this podcast on ksgindia.com. Thanks for listening and do subscribe to our channel.